A silent threat: understanding acute renal failure. Acute renal failure, also known as acute kidney injury, is a serious condition. It involves a sudden loss of kidney function. This means your kidneys can't filter waste products from your blood effectively. ARF can develop over hours or days. It's crucial to understand this condition because it can be life-threatening if left untreated. However, with prompt diagnosis and treatment, many people can recover from ARF. It's important to note that ARF is different from chronic kidney disease. Chronic kidney disease develops slowly over time and is often irreversible. ARF, on the other hand, can often be reversed with proper medical attention. Think of it like this: if your kidneys are like a filter, ARF is like a sudden clog, while chronic kidney disease is like the filter slowly wearing out. The good news is that with timely intervention and appropriate management, most patients can regain full kidney function. This highlights the importance of early detection and seeking prompt medical attention if you suspect any signs of ARF. Remember, knowledge is power, and understanding this condition can make a world of difference in your health journey. Unmasking the culprit types and causes of ARF. To understand ARF better, we need to look at its three main types: pre-renal, intrarenal, and post-renal. Each type has different causes, which helps doctors determine the most effective treatment approach. Pre-renal ARF occurs when there's insufficient blood flow to the kidneys. Imagine a kink in a garden hose. The water pressure drops significantly. Similarly, conditions like dehydration, heart failure, or low blood pressure can restrict blood flow to the kidneys, leading to pre-renal ARF. Intrarenal ARF, as the name suggests, involves damage within the kidneys themselves. This could be due to various factors, including inflammation, infection, certain medications or toxins. For instance, a severe allergic reaction or an overdose on certain painkillers can directly injure the kidneys, leading to intrarenal ARF. Post-renal ARF occurs when there's a blockage in the urinary tract, preventing urine from draining properly. Think of a blocked pipe in your house. Water backs up and causes problems. Similarly, conditions like kidney stones, an enlarged prostate, or tumors can obstruct the urinary tract, leading to post-renal ARF. The ARF timeline: phases and their markers. ARF typically progresses through 4 distinct phases: initiation, oliguric, diuretic, and recovery. Understanding these phases helps healthcare professionals monitor your condition and tailor treatment accordingly. The initiation phase is the initial insult to the kidneys, lasting anywhere from a few hours to a few days. During this phase, there might be subtle changes in urine output or blood tests, but often there are no noticeable symptoms. The oliguric phase is characterized by a significant decrease in urine output, typically less than 500 milliliters per day. This happens because the damaged kidneys can't filter waste and excess fluid effectively. As a result, waste products build up in the blood, leading to various symptoms. The diuretic phase marks the beginning of kidney recovery. Urine output gradually increases, often exceeding normal levels. This is because the kidneys are starting to heal but aren't yet functioning optimally. Electrolyte imbalances can occur during this phase, requiring careful monitoring. The recovery phase is the final stage, where kidney function gradually returns to normal. This phase can last anywhere from a few weeks to a few months, depending on the severity of the initial injury and the individual's overall health. Section 4. Red flags. Recognizing the signs and symptoms. ARF often presents with a range of signs and symptoms, varying depending on the underlying cause and the stage of the condition. Recognizing these red flags is crucial for seeking timely medical attention. One of the most common symptoms is a decrease in urine output. You might notice that you're urinating less frequently or that the volume of urine is significantly reduced. However, in some cases, urine output might remain normal, especially in the early stages. As waste products accumulate in the blood, you might experience nausea, vomiting, loss of appetite, fatigue, and weakness. These symptoms are often nonspecific but shouldn't be ignored, especially if you're at risk for ARF. Fluid retention is another common sign, leading to swelling in your legs, ankles, feet, face, and hands. This happens because your kidneys can't remove excess fluid from your body effectively. Other symptoms might include shortness of breath, confusion, drowsiness, seizures, or coma, especially in severe cases. If you experience any of these symptoms, it's essential to seek immediate medical attention. Section 5. Unraveling the mystery diagnosis of ARF. Diagnosing ARF involves a comprehensive approach that includes a thorough medical history, physical examination, and various laboratory and imaging tests. Your doctor will start by asking about your medical history, including any pre-existing conditions, medications you're taking, recent illnesses, or exposures to toxins. This information provides valuable clues about the potential cause of your symptoms. A physical examination helps assess your overall health and look for any signs of fluid overload, such as swelling or high blood pressure. Your doctor might also listen to your heart and lungs for any abnormalities. Blood tests play a vital role in diagnosing ARF. Elevated levels of creatinine and blood urea nitrogen, or BUN, in your blood indicate that your kidneys aren't filtering waste products effectively. Urinalysis helps evaluate the concentration of your urine, detect the presence of blood or protein, and look for any signs of infection or other abnormalities. Imaging tests, such as ultrasound, kinetic scan, or MRI, might be necessary to visualize your kidneys, urinary tract, and surrounding structures. These tests can help identify any blockages, tumors, or structural abnormalities. Section 6. Turning the tide treatment and management of ARF. Treating ARF focuses on two main goals: addressing the underlying cause and supporting kidney function while they recover. The specific treatment approach depends on the type and severity of ARF. If the cause is pre-renal, the focus is on restoring adequate blood flow to the kidneys. This might involve intravenous fluids to treat dehydration, medications to regulate blood pressure, or addressing the underlying heart condition. For intrarenal ARF, treatment aims to control the underlying condition damaging the kidneys. This might involve antibiotics for infections, corticosteroids to reduce inflammation, or stopping any medications that might be causing harm. In cases of post-renal ARF, the goal is to relieve the blockage in the urinary tract. This might involve removing kidney stones, inserting a catheter to drain urine, or treating an enlarged prostate. In some cases, dialysis might be necessary to filter waste products and excess fluid from your blood if your kidneys can't do so effectively. Dialysis acts as an artificial kidney, helping to maintain your body's fluid and electrolyte balance. While ARF can be a serious condition, the good news is that with prompt diagnosis, appropriate treatment, and careful monitoring, most people can recover fully. Remember, early detection is key, so if you experience any symptoms suggestive of ARF, don't hesitate to seek medical attention. Your kidneys will thank you for it.